Now I'll introduce Ben, who's director of EcoAmerica's Climate for Health program, which is the national initiative to build climate leadership and action in the health sector, advancing solutions to protect personal and community health. Ben started his career as a community organizer in New Orleans, supporting neighborhood leaders and building power in communities recovering from Hurricane Katrina. He has studied and worked within systems of safety net healthcare for over 14 years, and he's developed cross-sector partnerships to address root causes of health inequities. He received a BA from Tulane University and an MPP from Georgetown University. He lives in Maryland with his wife and 2-year-old daughter and 2 dogs, where they all enjoy camping, finding hidden gems in their community, and figuring out new recipes together. So take it away, Ben. And I think Ben said he's going to share his screen and that he welcomed interruption and questions. Was that correct, Ben?
That is correct. Thank you so much, Lisa. It's great to see everyone today. Yeah, so yeah, I'm excited to jump in. I think I'll just be talking some about some of the tools that EcoAmerica has. We really are focused with the Climate for Health program on reaching health professionals and then making it as easy as possible for them to engage in different levels of climate action, from kind of if they're just getting started to being kind of full-time activists and everywhere in between. And so I'm going to be walking through a little bit on our Climate for Health Ambassador training, talking about some of our other resources. And so, yeah, like Lisa said, once I start sharing screen, it'll be tough for me to see the chat. So please don't be shy about just turning your mic on and yelling at me. And I can pause and switch over to seeing people's faces and chat about it. But yeah, I will be pulling this up and should be loading. There we go. So I'm just going to jump around these slides a little bit. Lisa already did a great job introducing EcoAmerica and the Climate for Health program. We have a really great network of national organizations. I mean, I think that there is consensus in these different health organizations that climate change is a serious risk to human health and a priority. They all have taken, different levels of steps. Even the relatively small C conservative organizations have climate statements, have formal commitments, and we're working with them to kind of advance those commitments, have more visibility, and then reach their memberships with things that they can do to start taking more and more action. And one of those I'll be talking about is the Climate for Health Ambassador training. So this is a 3.5 to 4 hour training. It's online, it's self-paced. The online version is already accredited for 3 units of CE. We offer this at no cost, and that's for docs, nurses, PAs, psychologists, social workers, dentists, dietitians, and pharmacists. And then we also this training, I would say that in my experience, kind of the more letters that someone has after the name, the more they say, I'm not an expert about this other thing, and I'm not qualified to talk about it. And so this really tries to cover the basics, get people over that hump, and that this is related to health, that you know enough to talk about it as a health priority, that the solutions are there, available, that they are accelerating. They need to accelerate faster. They need to be expanded on faster. And then I think that the strongest core piece of this training is the communications section, where we is based on EcoAmerica's research on best practices to engage people in climate action. So the link is right there, climateforhealth.org/ambassadors. And then there's a special code, MiCCA, that you can use once you get to that registration page, that will make sure that we keep a tally of everyone from the Michigan Clinicians for Climate Action that took the training. I just looked it up. We have 13 or 14 people who have taken the training and signed the commitment to be an ambassador currently from Michigan. I think 1 or 2 of those are through our faith program, and the rest are all through our health partners. But yeah, we're really excited to kind of grow that network. We continue to engage people with different action opportunities. And then if you do join that network, you can directly offer, here are action opportunities coming up, to your colleagues in the state, and then also as for federal actions as well. Second. And then of course, yeah, this is the full rundown of the CE. And so just bouncing back for a second, I would also just say this is really useful. I'm not just pitching this to the folks in the room, but if there are networks at your workplace or your university, this can be a really useful way to kind of build your base both for projects for Michigan Clinicians for Climate Action, but also, for your local green team or for a planetary health project within a university, that this is a good recruiting tool and that those free units of CE can be a nice little carrot to get people engaged. But I'm going to run through some of the training. I'm going to be moving real fast through these because I feel like I'm preaching to the choir on a lot of this. I want to get to some of the communications workshop, let you guys see how that is, and then have enough time for Q&A and discussion. But like I said, interrupt me anytime. This is just, we spent a little bit of time in the training talking about that climate change is affecting us, that it is real, it is human caused. I'm not going to go into detail. The scope of the impacts are to me very obvious. I don't get a lot of pushback on that at this point. I think we went from having $4 to $5 billion disasters a year in the 90s to now routinely over 20. I think we've already passed 20 in 2023. And so I think that this is one of those, I find this a very heartening chart that when we poll Americans, we find that 75% are concerned about climate change, with a plurality, 45% saying they are very concerned. But when you ask how concerned are others around you, that plurality answer goes to being the smallest answer. That only 14% of us think others around us are very concerned about climate change. And so that dissonance is called pluralistic ignorance, and it directly affects our behaviors. If we think we're alone, if we think that we're going to encounter resistance talking about this, that we're the only ones worried about this, we're the weirdos, we're way less likely to talk to our friends, family, and neighbors about climate change and about opportunities for action, because we're anticipating that resistance. And the reason I find this an optimistic chart is because it's very clear what the answer to this is to talk about climate change more. And that you're going to be pushing on open doors a lot more than you think. And that what our training does is try to give you tools on how to frame that conversation and how to answer some of the follow-ups to make those conversations effective and productive. And one of
I have a question there, Ben.
Yeah.
Does your training go over, and you don't have to, you can keep sharing. Does your training go over how to talk to patients in particular?
So that we don't have a specific kind of bedside engagement. The closest that we have at this point is that we've developed the ClimateRX badge program, which is aiming to make it really easy to have those conversations. And at that, we're starting to develop conversation starters on how to bring up climate change in the context of the patient's health. So obviously, wildfire smoke was a significant health concern, and so talking to people about where are the resources to keep yourself safe, what should you be looking out for, same with heat waves, I think are really natural ways to have those bedside conversations. And then what we're working on more and more, and would love feedback on this from people out doing bedside care, is that transition to and here's where you can learn more about it. So that's why we did develop the badge, to try to make that off-ramp a productive off-ramp, to say, if you want to learn more about how climate change affects health, you can scan this badge and it goes to climaterx.org, which is a website we developed.
And if somebody becomes an ambassador, do they automatically get the badge, or do they have to also sign up?
You have to request
separately.
Yeah, you have to request the badge. Anyone can go to climaterx.org and request a badge. I'm happy we send them out. And then again, if you have a group of colleagues that you think are interested and you can distribute 20 or 30, I think for shipping, the easiest minimum size is around 30. We'll fit into one of those small packages. Happy to send out bulk orders. And then I've been in slow conversations with health systems. They move at the speed of bureaucracy for those kinds of mega orders where you're going through a whole health system. But that's really the goal, is to get it so that this is something that is routine, that there's both that signal of the badge that here's a clinician thinking about climate change and health, and then also those opportunities for those conversations. That again, we're trying to make it real easy to have short, fast conversations. You're not going to be diving into a 45-minute conversation about climate change with a patient, but more like a 30-second or so.
Great, thanks.
Yeah. And the reason that this is so important for health professionals to do this, again, I'm sure I'm preaching to the choir, health is the biggest motivator for people to take action on climate change, kind of wherever they are on the scale of being worried about climate change, denying it's a problem, to being already active, bringing up personal and community health is the number one motivator for people to do more. And then my final chart on this, again, I'm sure you've seen this before. Health professionals are the most trusted profession in the country. I think these stats are from 2020. The numbers have dropped a little bit since 2020, but still nurses and doctors are the two most trusted professions in the country. And so I know it doesn't always feel that way, but this remains true. And so that intersection, that talking about climate change breaks through this bubble, this cognitive dissonance that you're alone, that health is a motivator for people to take action, and that health professionals are the most trusted people in the country, especially when talking in the context of health. It really is why my job exists, why we spend so much time focusing on helping health professionals to bring up climate action, and connect climate solutions with both the long-term and immediate health benefits of those actions. All right. And here's where I'm going to go into super duper speed on this, because I don't think I need to go into too much detail on the health impacts of climate change. Our full training, I think, spends about 45 minutes or an hour on this, of the 3.5, 4 hours. So we really try to go into detail to help people feel confident, understanding how these climate pressures lead to negative health outcomes. And of course, also how it intersects with social drivers of health and exacerbates existing disparities. This is how I got into this work. I spent, like Lisa said, I spent well over a decade working in the DC area, not thinking of myself as a climate person at all, just on food insecurity and basic healthcare access for uninsured patients who don't qualify for Medicaid due to their immigration status. And then starting to see the connections between that work and climate change. For me, the big aha moment was understanding that the thousands of children joining the program for uninsured children with marginal immigration statuses was caused by a 10-year-long drought in Central America, in the Northern Triangle countries in Central America. And that those were kids that were getting relocated with cousins, uncles, aunts in the DC area. And then not only were they food insecure, but also had all the trauma of displacement and often long-term detention and a culture of stress. And so understanding that local health crisis that I was working on was a direct impact of climate change was, for me, the real turning point where I was looking for ways to get more engaged in this work.
That's a really powerful story, Ben. And I think, it brings home one of the points that I think whenever I'm educating on the health impacts of climate that I try to emphasize is, I think that the most common way that we see climate change impacting health is ways in which it exacerbates pre-existing conditions. So your description with these young children, obviously the mental health impacts of what you've just described, in addition to the food insecurity and just forced migration, is huge. And I think that happens disproportionately to marginalized communities, but I also think it happens in more subtle ways with everyday, with all people. And I think we overlook it in our clinical practice because we think, oh, well, here's a diabetic patient and here's a patient who has renal insufficiency, and we haven't connected the dot that patient with renal insufficiency keeps showing up on hot days when they're working out in the field, and those social determinants. So that's a great, really powerful story, Ben.
Yeah, and thank you, Lisa. Yeah, and I think that example it flows right into my next slide on heat. But yeah, that these impacts across all of them. Like I said, I'm going to try to go through these at warp speed. But like Lisa was saying, the biggest vulnerabilities and the impacts of these are people with those pre-existing conditions, older people, small babies, it's always hard to untangle the causality. I'll leave people's regression analyses to figure all that out, but it is very clear that increasing the number and frequency and intensity of hot extreme weather like this is going to disproportionately and negatively affect the health of people with those pre-existing conditions and people who, due to decades of residential segregation and policy, are living in neighborhoods with no tree cover or don't have access to air conditioning or other cool spaces to kind of cope. So all of our work needs to kind of be grounded both in the urgency to do the mitigation to reduce those emissions to protect ourselves from future impacts, as well as the immediate work of reducing the harms and increasing resilience and adaptation resources for those local communities. So like I said, moving through these real quickly, people understand that heat is bad, is extremely deadly, and is the most obvious impact of climate change. It's not just in the South. Some of the hottest warming cities are in Montana, Vermont, Pennsylvania, and that a 90-degree day in Texas is different than a 90-degree day in Portland. That the infrastructure in Portland is not built for extended heat waves, and so it can be a lot more deadly in some of these areas that is a new experience to have a 10-day heat dome sitting over them. So heat is really a significant risk, and that in addition to some of those residential segregation factors I talked about earlier, there's also the fact that outdoor workers tend to be people of color and face extremely higher levels of exposure to the impacts of extreme heat. Fire and smoke, both the actual fire, the anxiety of an approaching fire and all the terror that brings. And then as a large part of the country experienced last was it May, June? I think ongoing, I think of it as June because the DC area got hit real bad by the wildfire smoke from Canada in those first couple of weeks of June. But
Here
those are,
too.
yeah, it's really devastating impacts from wildfire smoke, both the physical impacts and then not being able to go outside. I think I've shared that, yeah, that was the first day my daughter woke up wheezing ever. And so, it was really distressing. Like we kept her home from school. My wife didn't go to work that day. So it can be really disruptive to these events. And that even outside of wildfire smoke, air pollution, primarily from emissions, but also from extreme heat, which concentrates ozone in the air. That people of color are exposed to much higher levels of air pollution, and that leads to really disproportionate health outcomes where Black and Hispanic children are much more likely to have asthma and 2 to 4 times more likely to die from asthma, and Black women have the highest rate of asthma and the highest death rate from asthma than any other group. So we can see that some of these are existing disparities caused by structures we have in place that are going to be exacerbated by climate change as air pollution worsens, both from wildfire smoke, from ongoing emissions, and from increased heat, especially in areas where there's heat trapped. And then air quality combined with heat is a real nasty phenomenon. So 20% increased mortality risk on days with both high temperatures and poor air quality. Going to move a little bit faster. Hurricanes are very bad for your health, both the traumatic event and then the long-term impacts of flooding, mold, displacement, and lack of healthcare access. Mosquitoes and ticks have a much broader range, and this causes significant health concerns here. Where I live in Prince George's County, Maryland, we just had our first case of locally acquired malaria in something like 100 years. So I'm not too worried about malaria in Maryland, but you're going to definitely see chikungunya, dengue, West Nile creeping up from being tropical diseases to being diseases that are on the mainland of the US. And that ticks and Lyme disease will probably be a much bigger concern for Michigan, but will also be something that continues to expand as the temperatures warm up and maintain and freezes become more separated. And finally, and kind of fitting to close out the impacts with mental health, since it is very distressing to talk about this. And as we'll get into in the communication section, we really strongly urge everyone to not do what I just did and run through 6 or 8 different climate impacts and how bad they are and how unfair and unjust they are, because it's distressing and demotivating to talk about that many in sequence like that. But closing off that, climate change does have significant impacts on mental health. We've worked with the American Psychological Association since 2014 on reports. I actually need to update this. We just launched our 2023 report, which focuses on the impacts on children specifically. But feel free, if you want to learn more about this, about how the mental health is affected both by the physical impacts of climate change as well as the social and community and traumatic impacts of climate change. There's a lot of really useful research as well as strategies for how to manage that. So I don't think that we need to do this reflection exercise, but I just wanted to share that these are things that are cutting across the entire country. Like I said, the scope of these impacts is really I don't get a lot of pushback from people when I'm talking about this, that this is serious. And when I start naming these things, again, it's not something where people might get exhausted or bummed out if you go through too many of them. But again, I feel like we're past the point of flat out denial. You get into more excuses or reasons not to act, or it's too big, which is why kind of we try to make some of these solutions as straightforward and simple as possible. So we talked some about the really basics, that we just need to switch to things that are not burning fuel for energy and for and instead using cleaner sources while restoring nature. And I would say the most important thing about when talking about solutions, well, I skipped over one thing, but one of the more important things is that progress is happening, that there really are significant structural changes from how things were 5, 7, 10 years ago to where we're in reach for significantly reducing the harms. We can do a lot. Every 10th of a degree matters, and where we are now is a lot better than when we were 2 years ago, and we can keep on accelerating and really make a difference. And then the other point is that taking action on climate change, most of the actions bring other really significant benefits. The example I go to over and over again is I have vivid memories every single day riding the bus to school and getting off and then walking through rows and rows of diesel buses that were just idling and breathing in those fumes, taking multiple puffs of my inhaler just before I even enter the building. And we know that's really bad for kids. And then repeating the whole thing at the end of the day to get to my bus to go home. And we know that's really bad for kids to breathe diesel. It's bad for their health, bad for their academic performance. And it's also just completely unnecessary at this point. There's a huge amount of funding from the IRA for school districts to switch to electric buses. It's kind of the perfect thing to switch to, because it spends all day in between pick up and drop off recharging. And then that's something that we can take action on right now, that is this climate action that also protects our kids' health. So there are all kinds of examples like this where focusing on those immediate local benefits of our climate action, whether it's, insulating your home and switching to better light bulbs saves you money. Switching from a gas stove to electric stove means reduces the likelihood of your kid getting asthma. So focusing on these immediate benefits can really help to cut through the size of the program, especially when you're talking about kind of the individual actions and things that people can do. That talking about these in context of, yes, you're taking a climate action, but do the things that are bringing extra to you in ways that matter to you. So, I'm able to bike to work a couple of days a week, and I find that really enjoyable. The average American diet has about 2.5 to 3 times more meat in it than what any dietary body in the world recommends. So eating a more plant-based diet, or more plants and less meat, isn't just a climate action, but is something that is likely to be really good for you and make you feel better day to day. So all of these things, talking about ways that you can take these actions as an individual, because they bring you these additional benefits. And so we talk about individual actions you can take because there is a collective impact of all of us doing this, but also people who take these actions are more likely to go on to take more actions and to feel like they're part of it, to build this as part of their identity and their commitment. And so this is kind of the yard sign effect, that we want more and more people to have made a tangible positive commitment on this in their personal lives, and then keep on building on that in ways that drive towards systemic change. We put together some guides on how to do this work, both in a kind of iterative way, whether it's in your home, in your with faith-based organizations, with your workplace. And then there are just really incredible resources out there, more and more every day for health providers. We link to a lot of these. I'm updating all the time on the ClimateRX website. I'll just pause on the EcoAmerica's Climate Resilient Toolkit, Climate Resilient Clinic Toolkit. They've just put together really comprehensive guidance on several different climate impacts, and both what with fact sheets for patients, providers, and clinic administrators on how to act on these. And again, this is all focused on resilience and adaptation, which can be really a powerful way to get health professionals committed to this, and then continue on to that mitigation, to those reducing emissions. So really happy with these tools. I work a lot with the APHA and other public health groups. The APHA, I think, is going to be updating with CDC on a new brace toolkit very soon. But there's really exciting work on getting this resilience and adaptation work out to local communities in ways that they can see action. And I mentioned at the top of this the ClimateRX toolkit, which is something that we try to make it so that health professionals can engage in this kind of action and advocacy every day. Like I said, these are all free tools, and I can send out badges and work with folks on the ambassador training as one-on-one.
So is the idea with a badge, Ben, is that you just wear it with your other identification, and because it has the term ClimateRX, it kind of stimulates the conversation. You let the patient kind of notice it, or how do you envision that?
Yeah, so for some people, they just wear it, and every now and then it sparks a conversation with patients or colleagues. Other people are more proactive, and we've started publishing little conversation starters with different areas of subjects. So like I said, with extreme heat, if there's a current heat wave, giving people the information on that they need to protect themselves in that heat wave. And then saying, if you want to learn more about how climate change, about how you can protect your health from some of these climate change impacts, you can scan this. So prompting people to engage with it. But so this is something, again, this is relatively new. We launched this a year ago. We're continually updating this. We're always looking for input on how this could be more effective and how people want to use this. We've developed printed posters for waiting rooms. We're also really open to kind of other ideas that people have on how to use these tools. And that kind of flows into that we ask health professionals to engage in climate advocacy, and we just want to reassure you, it's not necessarily, I don't think I need to reassure this group, but reassure others that it's not necessarily capital A advocacy. That is part of it, but that advocacy can also be talking at your school board about if we're going to put proper air purifiers, filtration, and insulation in the building to be more efficient and safer for the children. And doing that as a health professional carries a lot of weight. And I think that, I advise people, even if you don't necessarily wear scrubs or a lab coat or a stethoscope, if you have one lying around and you're going to go talk to the County Health Improvement Commission, that does bear extra weight. Silly, but it really does matter. And that kind of performance can bring people out and listen to the points that you're making, especially kind of framing it around those health impacts.
It was fun that when we did our day of action in Lansing, we wore white coats and scrubs, and people noticed it and came up, and that's a great idea, Ben.
Yeah. Yeah, it feels silly and cheap, but it really does make a difference, as silly as it might be. Yeah, so leadership from health professionals matters. I've talked about this before. Politicians, especially, and policymakers really do respect health voices and defer to that authority on a lot of things. Not all the time, but talking about the health impacts as a health professional will get people do listen to that. And so I'm going to dive into some of our communication guidance for this. And so we have a 5-step process on how to communicate on climate and health. So we've done a lot of market research on this, testing. Oh man, I have those font problems. Sorry about that. That should say inspire and empower under number 4 instead of whatever that character is. But yeah, so the flow of this of the kind of climate message should go from connecting with their target audience. So you kind of have to know who you're talking to, and connect with their values and their priorities. Making it real, the second step is about talking about climate impacts that are local and current, not parts per million of carbon, not polar bears, not things in 2100, but things that are happening right now in the community. That ED visits for children with asthma spiked during the most recent heat wave by this amount. And here's a story from one of the parents who had to miss work. The kid missed a week of school, and now they are facing, whatever. It's kind of those kinds of stories paired with stats to make it real. And then going on to focus on how solutions to this problem also bring immediate personal benefits. Fourth, inspiring and empowering that these actions do make a difference. It's not too big. It's not something you can blame on China and say we can't do anything about it, that we can take action right now and make a difference. And then finally activate where you have your ask. And so really going into this, I usually start with saying, know number 1 of who you're talking to and what their priorities are, and know that number 5 of what your ask is, to really make sure that these messages cut through. And then for any kind of PowerPoint slides or images, focusing on more positive and human focused messaging instead of things that, like I said, I love polar bears. I love charismatic megafauna. It does not convince anyone who's not already on our side that making it more personally relevant and more focused on those individual things that people can do and the benefits that it will bring from them doing it. So I'm going to try to move through this really quickly for each of these. So starting and staying with people, like I said, you want to connect with people on common values that, I'm here, I'm a medical professional. I'm doing this work because I care about the health of my community and I want to protect it from these impacts. And then making it real is talking about the local impacts of climate change that you're fighting against. Some facts and some data can be useful. Stories are always better, unless you're talking to a true kind of robotic wonk. Usually 1 or 2 stats and then a story, and you have a patient who this has happened to. You can anonymize it in your telling, and connect with people around other human beings that are like them, that live in their same community. So this is where we emphasize, don't do what I did earlier and go through 7 or 8 different climate impacts. Do 1 or 2 and then get onto those solutions and how they bring immediate benefits. We tell people to avoid talking about sacrifice or trade-offs. Sometimes there is a cost of doing things like putting solar panels on your roof, but it's not about you're making this sacrifice because of climate change. It is about, you are now going to save money. You are now going to no longer have to rely on this dirty polluting tools. It's about, and same with if you're switching your car to an electric, that there are all these benefits that come with it immediately. So focusing on those, you're doing it for the benefits, it's not about trade-offs and sacrifices. And usually the 3 big categories of benefits that people connect with are saving money, improving their health, and then things that bring value to their community. So having green spaces in your community is a huge climate and health benefit, and also a community benefit. And so kind of making those connections with folks about how these actions are not about sacrifice or trade-off, but are about benefit. Inspire and empower, it's really easy when talking about this, that it is a global planetary problem. It can feel too big. It can feel too late. People are getting a lot of messaging about it being too late, and we've already have so much damage baked in. But focusing on, again, as there are areas that now where there's such a concentration of electric cars instead of combustion cars, that children there are breathing cleaner air than their parents breathed. Or even that their older siblings breathed. That we can make a real rapid difference for a lot of people by taking action, and prevent a lot of harm as well. And then, like I said, ending with that activation of having to ask. And so our training spends more time on this. When I do this full training live, I try to spend almost about an hour just on this communication section to really give folks a chance to practice outlining and developing a message, critiquing some messages and talking through. I know that we just have 15 minutes left, and so I want to give folks a chance to have questions and answers. I'll just share again that the full ambassador training, I'm happy to do live trainings for people if they want to organize it. If you can get kind of 50 or 60 people together, I'm happy to come and do a full 4-hour training. And that the nice thing about the online on-demand one is that the CME is already taken care of and credited. And so you can kind of get people in the door with that carrot, and it's already all taken care of and free. And then here's my contact information and all of our handles, but I'll switch over to the main screen so people can ask questions.
Wow, what a wealth of information, and so beautifully, beautifully put together. I think the communication stuff is just really amazing. I can also see, I think engaging with patients is really an interesting component, and the ClimateRX, I could see that would really be powerful. So I've talked and made my comments as we've gone along. I want to pause here for questions from other people. Mary Lee, you said, wow. Any specific questions for Ben? So well thought out, says Sarah. Thank you. I need to learn more. I don't know. Clearly. Yeah. Thank you. Thank you, Sarah.
And I just saw Eric's note about door knocking campaigns on some of this. So I know that there was, I think Climate Nexus worked on a website dedicated to indoor pollution from gas appliances. If I can track that down, I'll send it over to Lisa so she can share. And then for the IRA, I know that the Medical Consortium and NAC, the National Association of Community Health Centers, are working on some new toolkits and on encouraging people to use IRA funding and giving them resources on connecting with it. So hopefully we have those very soon. I'm really excited about those. But yeah, really exciting campaign too, Eric. Yeah.
Thank you very much. Great presentation.
Thanks.
I'll just say something for a moment, Ben. I love the communication, especially because I've been thinking a lot about that and how we do it. And you've got such a clear path. One of the things that I see as a potential stumbling block is educating ourselves about what the local problems are, and finding that resource to be able to speak cogently about what's going on in my neighborhood, or maybe somebody else's neighborhood that I'm entering to try to do something.
Yeah, I think kind of depending on the audience, it can be, and if you have a really specific ask of decarbonizing or making this investment or supporting this policy, it can be a lot of work to do that research on how to connect with them more effectively, of finding a couple of stats. I think it's helpful to have a story bank of your own. I think every organization I've ever worked with always said we need more stories, we need to do a better job collecting stories. But I think as an individual, having kind of a personal bank of anecdotes that you can draw off of I know about this patient, or I know about this family, and this is how they and their health and finances were affected by this, and here's how this solution could have helped them. So I know that's not super helpful. It is doing this right and making that connection with people, so to draw them into that productive action can be some labor intensive. And I'll just add that also that kind of 5-step framework also can be I think it's useful to have that kind of as muscle memory. That when a organic conversation comes up with someone I don't really know, obviously I'm not able to do research, I don't have a real hard ask necessarily, but I can talk with them about this and rely on those core principles of making it about real world impacts, making it about solutions that are tangible, and avoiding implying some great sacrifice or emphasizing the planetary scope of the challenge and focusing more on the individual and local benefits of action. And I find that that's just really it's been really helpful for me to shift my conversations on this from being depressing and like leaving people like walking away to fill up their beer to being ones that are more productive and people feel they want to do more on this. That they're looking for ways to get engaged.
That's been my experience been over the decade or so that I've, done public health presentations. If you stop with the gloom and doom, now I do the mistake that you have, Ben. If I have an hour, I feel probably 10 minutes worth with these anecdote. I try to do an anecdote to couple with an impact on the CDC will, but I do have kind of this sequential gloom and doom. And then I transition to what can we do about it, and that climate solutions are health solutions. I think it does. I mean, they will shut down completely if you don't get to the second part of the discussion. And maybe what I need to do from this lecture, Ben, and thank you, is marry the solution sooner to the problem, not like put all gloom and doom and then solutions, but couple them more closely. Is that what you would suggest, Ben?
Yeah, and I think I wasn't practicing what I preached today. I mean, I did spend about 10 or 15 minutes just on those impacts. But yeah, I think that with an audience where you want to be driving them toward solutions where they are already committed, I think that just acknowledging that wheel of impacts, picking out one or two anecdotes and saying, if you want to learn more about all of these, feel free. If you're not kind of on the hook to do an educational training on climate health impacts, instead making that presentation acknowledge the scope and diversity of impacts, have anecdotes and stats for one or two, and then move on to the solutions instead of doing the full wheel. That's something I've been experimenting. Yeah.
One other thing I want to emphasize, because you've emphasized it, Ben, is the power of the clinical story. And just to do a little bit of selfish promotion, I just want to emphasize that is something that we are really trying to develop as a repository of clinical stories. And so I put in the chat, and if you a Google form that you can fill out, we can set up a time to Zoom with you. You can videotape yourself. It's not so much that we're going to take the stories and publicize them. We would like to develop that repository of stories that we can utilize when, in an anonymous way, like Ben is talking about, when we're educating our peers, our policymakers, writing op-eds, whatever. And then, if we come up with somebody who's really beautiful at telling a moving story, we would potentially ask you if you would be willing to share that story and formally record it. But we would never do that without, first asking your permission. And then we'd probably need the funding to formally record it in a good way. But so just shameless promotion on my part. If you have stories, it is incredibly helpful to us, especially if they're stories about treating patients who have been disproportionately impacted.
Yeah, and I'll just add to that the inspiration for the ClimateRX badge program was the Vote ER program, where clinicians wore a badge with a QR code to register to vote. And the logic of this is that getting people to register to vote in the context of health affects how they think about voting, how they think about that decision later on. It frames that entire process of voting, of considering candidates around health. And so we want to do the same thing with climate change, that because we know people are motivated to take action on climate because of individual and community health, we want people thinking about climate change in that context. And so cueing that, marking that up as many times as possible and repeating it is something that's really important. So the same with those stories, framing these things in the health context as a health priority for local health practitioners really changes how people think about climate change as being something that's happening over there, something too big for me to affect, or maybe I'll worry about it in 2050, to being something that we can, that's a priority now that we can take action on now.
That's such important information because I think many of us here have, really focused on the health impacts, but to figure out how to communicate it in an effective way is a piece that, we struggle with all the time. And so this is incredibly helpful. I know that Mary Lee was just pointing out that she has just finished a 6-month fellowship with Vote ER, a climate health fellowship. And she says she wears her badge at all the meetings. Anything else to add with that, Mary Lee?
Yeah, not too much, but it's not climate, it's civic health fellowship. It's about
Oh,
encouraging.
I read that wrong. Sorry.
That's okay. It's about encouraging people, including patients, although the patients I care for are all in jail. So I don't wear it at work. Anyway, but it's to get more people to vote. It's very nonpartisan, and a lot of their information really links strongly, can be translated into climate health. So but it's a good program, and we're just finishing it right now.
And I will say that over the last 2 election cycles, we have had a concerted vote for climate. A vote for climate is a vote for health initiative. Kaylee and her husband helped us do a really fun recording recently. Mary Lee was on it. Several of us put it together and got it out there. So keep your ears open for the fact that we will be pushing that out over the next year or so for sure. And Ben, I'll cue you up for what for your aspect of that.
Yeah, we're currently working on a month-by-month plan for Get Out the Vote engagement and support, where we have about 2,000, 3,000 people who have completed the Climate for Health Ambassador training and then signed a commitment to take action and to connect with their neighbors and communities. And so we're directly engaging all of them with monthly asks on how they can, each month is themed with different things they can do to prepare for the elections, to connect with their neighbors, and to help get out the vote. And so that we'll be sharing that outside of our network of ambassadors, of course, and both through the medical consortium. Lisa, I'll send it out directly to you as soon as we have that ready. But we're really eager to kind of give people a chance, give people scaffolding to build out more and more just regular engagement on this, on getting out the vote.
That's wonderful. And I really look forward to it. I like that month by month, and it might be something that we could utilize that then to push out to our whole thing. Well, we're at the top of the hour. This has really stimulated a lot of ideas and thoughts. It was a great presentation. Thank you so much, Ben. Antoinette, I noticed your comments. If you want to hang on, we can talk after this and think through that. But a big round of applause for Ben. And, thank you so much for taking the time. And thanks for everybody who made it here this month. Keep your eyes open. Our next one, educational meeting, we hope will be November 17th. So the week before Thanksgiving, not Thanksgiving weekend. We figured that would be great. Just to give you a heads up, and big thank you to you, Ben.
Thank you for your time, everyone. I really appreciate it. Thanks.
Bye-bye, everybody.